Wait, let me introduce you guys. Let me tell you what's happening. So today I got a call from my mother-in-law saying that one of my kids in my class got skin cancer, and that their mom wants to come and give a presentation about how to prevent skin cancer. Nobody has skin cancer, it was just miscommunication. But Caesar and a couple of friends from school, they did a project, and they're going to take the opportunity to share what they learned about skin cancer prevention. So I'll hand it over to Caesar. Go ahead. How's that work? You need more room?
Hi, my name is Alma. This is Carla, Cesar, Alexia, and Benjamin. We're from the middle school CVLCC, and we created a non-profit organization about skin cancer awareness. And well, that's what we're going to be teaching you today. Do any of you have anybody, a relative, who had skin cancer once or still has it? Do you have an idea of what skin cancer is? No? Okay, well, skin cancer starts in your cells and it causes your tissues to die. And most of the time it causes a mole or a rash, which is what makes it preventable. So most of the time doctors try to take the skin cancer out before it expands to other parts of your body. So they take it out in a football-shaped cut. It's pretty big, so if the mole is like this small, you're probably going to have a big cut. So, yeah. And who's at risk? The people with light skin, blue eyes, or freckles, or who tan easily are the people who are more risk of getting skin cancer. Other people can get skin cancer too, like a little dark skin, or if you don't tan easily, but it's not really a risk factor. But anybody can get it, especially if you're type 1 or type 2 skin cancer. Do you guys have any questions so far? No?
Your medical history also could increase the chance of getting skin cancer. Having a history of sunburns, especially blistering sunburns, had skin cancer, or blood relative has or has skin cancer, received a hormone transplant, had a long-term X-ray therapy such as an acne X-ray therapy, having an area of skin that has been badly burned either by the sun or by an accident.
Skin cancer is caused by the UV rays of the sun. There are 3 types of UV rays. There is the UVA ray, which ages your skin. There's the UVB ray, which burns your skin. These 2 are the most common types of UV rays that will cause skin cancer. There's also the UVC ray, which can't get through our atmosphere, so it's not a common cause for skin cancer. Melanoma does not have any symptoms. It will usually itch. Well, it doesn't have any symptoms. It may itch and it will bleed sometimes if you scratch it. And you should check your body monthly to see if you have any different moles or any changing moles that you see. And you should tell a dermatologist immediately if you see any changes in your skin.
Skin cancer prevention. Be sure to cover up your skin so that the sun won't affect you directly. Use long-sleeve shirts with reflective colors and wear a big hat. Sunburn, blisters, risk factors. Light skin, red hair, or people with type 1 or 2 skin run more risk of getting melanoma. Anybody can be diagnosed. People exposed to the sun in a young age may get melanoma later in their life. Preventing skin cancer. One way of preventing or higher because they work faster in your skin while going outdoors. Also, using sun protective clothing like I said, long sleeves or big hats and sunglasses, and avoid the sunlight between 10 to 4 p.m. And tanning boots can also affect your skin, and you can get skin cancer because they contain ultraviolet rays. Melanoma may also run in your genes. Sunscreens do recommend. I recommend you to use sunscreens that are SPF 30 or higher and apply them 15 to 30 minutes before. We recommend this because using sunscreens lower than SPF 30 don't have as much sun protection as the SPF 30 or higher, 60 and 70 SPF 30 SPF, depending on sunlight time exposure. We also recommend you to use sunscreen even though the sun is not out or you think you're not going outdoors.
Can get melanoma from different kinds of sun off the sunscreen. It has been proven to cause melanoma, or hasn't been proven to cause melanoma. Although this question has been asked various times. Tests and experiments are being taken to prove whether it does or doesn't. People said that they have caused melanoma by their sunscreen. Sunscreens with zinc oxide or titanium oxide act as physical blockers. They're thick, heavy, and white. ABCDs of melanoma. Ask your parents to help you check your body for any moles that fit your descriptions if you find a mole that looks different. These moles are symmetrical, but one side is different than the other. The border, irregular in the mole's edge, is not round, but it's like an oval shape. The color, the moles is multicolored and it loses symmetry with its dense colors and its spot. The diameter, the mole is bigger than 6 millimeters. Evolving, when the mole is changing or becomes different than the rest. Treatments after diagnosis. According to dermatology chief he says that skin cancer patient population has been growing. During early diagnosis, the mole is cut into a football shape and there's a big scar. After it's cut, there's lymph nodes, there's chest x-rays, and blood tests. Chemotherapy also plays a role in melanoma cases.
Are there any questions?
Is it true that the UV rays are stronger when it's overcast than when there's no clouds?
Yes, it's true because the clouds work as a magnifying glass, which intensifies the UV rays. Are there any more questions?
Any comments, suggestions? Well, like we said before, it's very important for you guys to check your body monthly because it's not easy to go through an experience like skin cancer. I mean, I had a friend who passed from skin cancer, and you should really check yourself. And if you see anything that doesn't seem normal, you should ask your parents to take you to the hospital. And would you guys like to take a look at the posters? Yeah.
Could you explain to us give us a quick summary of what's on the poster?
Well, basically it has what we said. Yeah, it's all the same thing. Well,
is this for like your service learning project?
yes.
Did you guys like choose that as your topic, or do you guys have other options? Like is that just the first one you had in your mind? Or?
Yeah, we chose it.
Okay.
Yes?
Why did you guys choose skin cancer? What was it like? Why was it so outstanding for you guys to choose?
Because we want less people to die of an easily preventable disease, which is so common in San Diego. And if you can just prevent it, it would help so many people in their lives. And because we want less people to die, basically.